we move forward towards achieving universal health care for all. Universal health care, or as we call it now, UHC, is one of the 4 key national development targets with an aspiration that all persons in Kenya will be able to access quality and affordable essential services that they need for their health and well-being through a single, unified benefit package without the risk of financial catastrophe. Nairobi, the country's capital, with a population of close to 5 million residents, has seen over 40% of its population over the years rely on Kenyatta National Hospital as their first point of access for health services. This has resulted in this county of Nairobi registering the worst health outcomes and disease burden nationally. Despite having the highest deliveries across the country, Nairobi, unfortunately, is ranked 3rd Nairobi, unfortunately, is ranked 3rd in maternal mortality, with 17% of infants also being malnourished. To achieve the key vision of universal health care in Nairobi County, in August of 2020, I commissioned the construction of 24 hospitals across Nairobi's 17 sub-counties with focus on informal settlements and other underserved areas. This program has since expanded to target the construction of 28 new hospitals and the expansion as well as the rehabilitation of 4 more hospitals across the county. We have so far commissioned a total of 13 hospitals, the first being in Uhuru Level 3 Hospital, which we commissioned in February of 2021. The commissioned hospitals have so far attended to over 95,000 patients, including inpatient services, surgical services, outpatient services in the hypertensive clinics, psychiatric clinical services, maternity clinical services, child welfare clinical services, antenatal clinical services, family planning services, and HIV testing services. These new Level 2 and Level 3 hospitals are fully equipped with modern medical equipment and staffed with more than 2,000 health workers, some of whom I have had the opportunity and have the pride to have met. And we are confident that these facilities and these health workers will ensure that the population of 3.1 million people living across our informal settlements will be able to access quality and affordable health services with ease without having to travel great distances. Today we are here in Kibera to launch 2 hospitals, both of them Level 3. These hospitals will collectively serve a catchment population of 490,000 people and further decongest Mbagathi Hospital. We will also be commissioning today a fleet of ambulances that will also be flagged today. This will also enhance our emergency response in this county and in particular in this area. Let me also say that we are happy to note that under the Universal Healthcare Program, the Nairobi Metropolitan Service has already identified, registered, and qualified over 326,000 vulnerable people for NHIF support. And 66,000 households have already started enjoying the service with NHIF, who are present with us here today.